A nurse was slapped while working the night shift. When she got up to look, she found nobody there. Seeing the handprint on her face, she knew it wasn't a dream and resigned immediately. Due to the hospital's shortage of night shift nurses working 12-hour shifts, they quickly agreed to interview a woman with previous night shift experience. They asked her to start that very evening, which she gladly accepted. While changing, the head nurse gave her the key to the intensive care unit and warned her to be especially vigilant. As the woman administered injections to patients, she suddenly heard singing. Stepping into the hallway to investigate, she found it empty, yet the singing continued. She forced herself to remain calm and return to her duties. She accidentally spilled iodine, staining her uniform. When she returned to the locker room to change, she discovered her locker door open. Footsteps sounded behind her, and turning around, she saw a figure pressed against the glass. The woman politely greeted them, but received no response. When she went to check, there was nobody there. Trying to ignore what happened, she changed clothes and prepared to give a patient an injection. However, the patient claimed they had already received one from a nurse wearing a black cloak, quite different from her uniform. Checking the records, she found someone had signed the chart, and medications on the tray had indeed been moved. Suspecting a prank, she confronted her colleague. Her colleague dismissed her concerns, stating that only he and the doctor had keys to the intensive care unit. No one else could enter. He suggested she might not have locked the door properly, which seemed reasonable. Suddenly, the lights behind her began to flicker wildly and footsteps sounded again. Turning around, she saw a shadow approaching. Just then, an alarm blared. Concerned for her patient, she rushed back to check, calling loudly for a doctor but receiving no response. She examined the patient herself, then urgently flipped them over, cut an opening in their back, and inserted a tube, which seemed to provide relief. A doctor suddenly appeared, scolding her for overstepping her role and warning that her actions exceeded a nurse's professional boundaries. After examining the patient and finding no additional harm had been caused, the doctor left. The next day, the woman returned to work as usual. The doctor asked her to prepare for surgery, but she explained she was only an intern and couldn't enter the operating room. The doctor replied that the bearded doctor had recommended her, citing her extensive experience. After changing clothes, she noticed a nurse yawning and kindly warned them not to fall asleep. The woman entered the operating room with the doctor, who began introducing various instruments, all of which she already recognized. Just as the surgery began, she heard humming again. The patient's blood pressure suddenly dropped. As she turned to administer medication, she discovered the nurse with the black cloak standing there.